Okay, welcome. Thank you for tuning in. You are now tuning in and watching the Department of Behavioral Health's Mental Health and Native Communities, What You Need to Know discussion. My name is Dennis Horn. I am the Diversity Services Coordinator here at the Department of Behavioral Health in Fresno County. And today here with me, I have two special guests who will be helping to drive this conversation about our Native communities and mental health. So without further ado, I would like to, start off with a land acknowledgement on behalf of the department and the County of Fresno. The Fresno County Department of Behavioral Health acknowledges that we are on the traditional territory of several nations, including Yokits, the Mano, Numu, Northern Paiute, Ohlone, and Salinan peoples. So we want to start with that. It is important that we do acknowledge this land to not only demonstrate recognition, but also appreciation of the lands and the peoples. So with that, I'd like to introduce our guests. Today with us, we have Dr. Kenneth Hanson, who holds a joint appointment in both the political science departments and American Indian Studies programs at California State University, Fresno. He has taught in the American Indian Studies program and been at Fresno State for 17 years now, Dr. Hanson.
That's correct.
He's taught contemporary life of the American Indians, Indians of California, American Indian law, and topics or courses on tribal governance and self-determination. He has worked with past President Joseph Castro on the CSU system and Fresno State's Native American initiatives. And he is a co-editor and contributor to the anthology, The New Politics of Indian Gaming. He serves as tribal staff for the Shalom Indian Nation located in Bakersfield, California. That is Dr. Kenneth Hanson. Thank you, Dr. Hanson. We are honored to have you here today.
Thank you all very much. It's nice to meet everybody.
Also joining us today, Mr. Angel Galvez. Angel has worked in the Indian health field with a vision of serving everyone with dignity and respect. He began as the Chief Operating Officer for the Tule River Indian Health Clinic at the Tule Reservation, and now serves as the CEO of the Bakersfield American Indian Health Project. His impeccable background in finance, leadership, management, and development, and his well-rounded experience in organizational oversight and accountability has prepared him to bring parity to the unserved and underserved population. Angel, thank you for joining us, sir. We're honored to have you as well.
Thank you, Dennis. Hello, everyone. It's a pleasure to be here.
All right. So today's discussion, we titled it Mental Health and Native Communities, What You Need to Know. Well, this is not a strictly clinical discussion. We'd like to hear about some historical context of our Native communities. We do want to hear about mental health in the communities and how we can improve mental health outcomes. So without further delay, we'll get the conversation rolling. I will have a few questions for you, gentlemen, and feel free to provide any insight that you may find pertinent to this conversation. So I'll start with you, Angel, Mr. Galvez. So CEO of the Bakersfield American Indian Health Project. What do you do there at that organization? Can you tell us a little bit about the work?
Yeah, sure. My pleasure. Originally, Bakersfield American Indian Health Project was established in 1997 as an urban Indian health center and is federally funded by the Indian Health Services to provide culturally relevant and community-defined practices. So what we do here is we provide outreach and engagement, medical case management, and referral and transportation services. And we also provide behavioral health and substance use counseling for all of those Native Americans that live in Kern County. And in August of last year, we launched a really robust community assessment to not only inform our next 5-year strategic plan, but also to really give us a pulse of what are those community defined needs? What is our population requesting? What are those serious, I guess you could say, priority needs that our community are faced with in terms of challenges and barriers? So that's just a little bit of a generalized
little snapshot
of information as to what we do here, or at least what we as a health organization prioritize for our people.
Well, that's incredible, and that's important work. And I don't want to bounce back and forth too much, but I do want to toss it back to Dr. Hanson, and maybe you can tell us a little bit about what you're currently teaching or working on at this time, and we'll want to hear from you maybe about a little bit of historical context and historical policies that have affected the American Indian, and especially those here in our region.
Okay, I guess what I've been sort of working on lately is tribal government related stuff. Tribal governments are different from a lot of other governments. They don't necessarily have the same kinds of revenue streams, and they aren't necessarily able to provide the same kinds of services that other governments do. You know, they're extremely limited by federal law and, you know, control of land resources, water resources, mineral wealth. All of those things are prescribed by the federal government, and they often do not work to the benefit of the tribes. It's often a disadvantage. And so that's kind of a difficult thing. A lot of what I teach in political science is public administration. So I don't really have, you know, behavioral health or mental health background at all. But I think what I can speak to is just the difficulties of the system that Native people have to deal with from top to bottom, whether it's the Bureau of Indian Affairs or the Indian Health Service, which Angel alluded to, the education department, you know, you name it, cities, counties, state governments, they all seem to put a lot of impediments into the way Native people interact with the rest of our society here. And people often assume, you know, we're made invisible. People often assume we don't exist anymore, or we're extinct. We're described as historical figures and as mascots. And there are places that have derogatory names like Squaw Valley. We call that the S word because it's a reference to women's genitalia, to put it bluntly. And so, you know, a lot of what we've been trying to do is sort of raise our profile and raise awareness that we're still here. It's a hashtag, still here. And land back is another one. And, you know, and land back isn't necessarily about property. You know, I'm not going to come pitch my tent in your front yard or anything. But what it's really about is jurisdiction. And so like when you did the land acknowledgement, you know, that describes the pre-colonial jurisdiction of the areas that we live in, and as a precursor to getting more control of resources and self-dependence or self-determination back. You know, that's kind of a good first step to do, which is why, you know, that's a welcome thing for a lot of us. I think it's important to keep in mind, though, the cultural diversity of Native people in this country. My own heritage is from back east someplace. As far as I know, on my mother's side, I have Shawnee, Cherokee, Lakota heritage, maybe a few other things, and it's mixed in with some English and French Canadian and that kind of thing. My father's side, he was supposed to be 100% Irish American, so I'm quite white passing. I was adopted into a white family, so I didn't grow up in a tribal community. So my experience is much different from that of a lot of other people's. And, you know, I sort of found myself into the culture later as an adult, but not too much before I got to the University of Arkansas, which is where I was before I came here. But you have more of the southeastern tribes there. which I may have a little heritage, but I'm not exactly sure how much. And then of course the adoption thing, that's adoption and fostering is a big deal in our communities, because for centuries government policy was family separation, and that causes a tremendous amount of not only loss of culture but historical trauma, and it might even be coded in our DNA. There's a study or studies about what is called epigenetics nowadays, and most of the scientific work has been done on Jewish communities. And because to do science you got to have an experimental group and you got to have a control group, and so they can compare Holocaust survivors and their descendants and what was done to their DNA versus people of similar heritage that didn't experience the Holocaust. And they've seen profound differences. We can't really do that with Native populations, because we don't want to be experimented on, because when the government experiments on people of color, or anyone else experiments on people of color in this country, it almost always goes bad. And that's partly why there's such a reluctance to get vaccines nowadays in communities of color. There's just a high amount of distrust, and it's understandable. But the other thing with that is that there's really no control group. Everybody who's Native, who's survived today, has survived this historical trauma. There's no isolated group that didn't get subjected to this that you could use as a control to see how it's affected our DNA, unless you just wanted to compare it to humanity as a whole. So it's difficult to verify in an experimental way, but yet we've all lived this, and people my age, anybody who kind of grew up or was born, in the 60s and 70s during what we call the termination era, they faced tremendous numbers of adoptions into non-Native families and fostering into non-Native families. And between certain years, it may have been as many as, and this has been documented, it may have been as much as 68% of the population of Native children were either adopted or fostered into Native families. And so today it's, I've got a handful of friends that, have similar experiences to myself in terms of adoption. I probably have about 5 close friends that were adopted out of their families, and some of them know who their families are and they've been able to find them. And I've had more trouble with that. I've had more trouble finding anybody who's more closely related than a second cousin. And, I've done the DNA tests and the whatnot.
Sure.
But they don't tell you, like, they can't break it down. Oh, well, you're 10% Lakota and you're 10% Shawnee and because DNA tests don't actually do that for you. All they can really do is tell you who your relatives are. Right. And then you just ask, and some people know and some people don't know, just depending. But our experiences with government programs, with CPS, you know what a mess CPS is at the moment. It's been all over the news in Fresno. These kinds of issues are very traumatic for Native people. A lot of our, grandparents, great grandparents, and even before them were put in the boarding schools, which were brutal experiments of assimilation and empire building. And that creates historical trauma. They were all severely abused, mentally, physically, emotionally, sexually, by what were supposed to have been good Christian people running these organizations. So we have generations of historical trauma here. California, you have to also keep in mind, is very culturally distinct from much of the rest of the continent. So California natives have different cultures compared to the ones, I'm a visitor here just like anybody else is who's not California native. Although I'm more likely to be invited to gatherings or ceremonies or that kinds of things than non-native people would be. I'm still a visitor here, and I still need to learn to be respectful. But the state of California committed a genocide against California Indians and did many of the same things that, the U.S. government and other states did in other parts of the country. But because the native people to California are culturally different, there were different reactions to that. The reservation rancheria system here was structured a little bit differently. The treaties were not ratified, unlike other treaties in other parts of the country. And what happened was about 90% of the population here was wiped out. And those people that survived typically no longer live on their traditional tribal lands, although there are 10 reservations in California. And I would argue that those people who live on those reservations probably are much closer, if not on their actual homelands, than other folks. But often it's the case that people are forced to migrate and assimilate into, say, the Mexican culture for a time, because there are barriers in California to Native people holding jobs where there are not barriers to Mexican American people at the same time. So people sort of lose their identity consciously because they don't want to be discriminated against or shot or scalped, to get to become a bounty for some settler or something.
Sure.
So the California tribe that I work with, the Cholone Indian Nation, they're originally from the coastal areas. They're out in the coastal range in what is now the Pinnacles National Park area, which is a nice place to visit if you've never been there. But they were incarcerated in Mission Soledad. And then when the missions were defunded and decommissioned in the 1830s, they were just sort of, set to wander in the ranchero period. And then, of course, were bounced around a lot when the Americans came and end up settling in Bakersfield in 1875 and are among the founding population there, in part because the only jobs a lot of people can find at the time are as farm workers. The state law prohibits Native people and migrants from Asia from holding actual employment or actual jobs beyond basic labor in California at the time. And some of those laws don't get repealed until the 1950s. Also, this was something I learned from Val Lopez, who's the chair of the Alma Mutsun tribe, which is the neighboring tribe to the Cholone. He said it was perfectly legal to traffic Native women in California until the 1930s. And in fact, human trafficking to this day affects Native populations much more than it does a lot of other populations in the United States. And the phenomenon of missing and murdered Indigenous women is something that doesn't get near the exposure that other kinds of disappearances and murders do in the media or from law enforcement. So these are just some of the contemporary issues. We're still here and we're still fighting kind of the same old battles we've always had to fight. And so, commonly when I do these sorts of things, some of the questions might involve, well, why don't you all just get over it? And Angel maybe can back me up on that, because he's probably heard the same thing before. But my answer to that is we'll get over it when y'all stop doing it to us. So this is a continuing struggle. And so, the trauma isn't just historical, although it is, it's also current. And so that sort of, contributes to the emotional and mental problems that a lot of Native people have nowadays. It contributes to self-medication and substance abuse. And, the lack of access to treatment, is related to that very same kind of discrimination.
Yeah, so that's something
I did intro, but I thought maybe I'll kind of stop there and see what else people want to talk about.
No, this is incredible. This is exactly what I wanted to have presented today, and I'm so grateful for your wealth of knowledge. You did talk about the trauma and a little bit about barriers and challenges folks have to accessing services. Angel, I know you can provide, some insight and some perspective on that, being from the health project there.
Yeah, I think we're touching on a lot of interesting points. Dr. Hanson mentioned a lot of great points about sort of these microaggressors that are still sort of used in general society. When you think about culture factors that inform Native American views of mental health, it's very different to how systems tend to address mental health services. We tend to address it with culturally defined practices like the gathering of Native Americans, and really looking at belonging, mastery, interdependence, and generosity as a form of really reaching the inclusivity and offering identity to those individuals who suffer from these generational traumas. There's so many microaggressors like stereotypes. When we think about like drumming and music, what's the common sound that you hear, that you think and associate with a ceremonial song? That's such a stereotype, and you're probably already hearing the beat. No Native American community plays that song, from cymbals to just the way we smudge and the way we ceremonially, and even talking about tobacco. Tobacco is such an important factor of Native American communities for healing practices and reaching mental health wellness via these ceremonial activities. And so, those are the things that we sort of embrace here locally, because we do have a robust behavioral health department that offers the Western philosophies of care, but we've also introduced to Western philosophies of care the traditional care that needs to complement that practice, right? So, smudging, let me talk a little bit about that, because I think that's important.
Yeah, I'd love to hear about that.
I have a abalone shell. Step back a little bit just so you can kind of see it. I have an abalone shell, and smudging, there's science behind smudging and the aroma, as well as, we use sage. I have sage and wheatgrass. These are the two things that I prefer to use. And, I'm not going to light this up right now, but when you light this up, smudging offers not only the ability to purify spiritually, to cleanse yourself, and there's different ways of doing that. We offer smudging to individuals, or we offer it to ourselves. We offer it to the creator, or we offer it to the sky. When you think of medicine wheel, we have our medicine wheel to rely on the directions, the 4 directions. And so when we offer it to ourselves, we tend to use, I don't have a feather here in my office at this point. Amen, Kenneth. We cleanse ourselves. And so one of the practices that we have included here as part of our clinic is that every person that comes through our doors is offered smudging as a form of healing. We don't know who's coming through our doors, and all we care is that person leaves better in the way that they came to us. And so before they see a counselor, before they see a primary care physician, before they see me or anyone, they're offered smudging. And so we have it's very sacred. We have a cultural, one of our cultural healers, Donna Cubitt, who's also our substance use disorder counselor. She is Native American, and she is the person that we have relied on offering smudging. And then we have a few other individuals that are also Native American that work for our clinic that are backups to her in the event she can't do it. But upon request, we offer this as a way of healing. There's science behind even the when you light sage, the sage is very thick and very powerful, the smoke. And there's science behind that. Even it kills certain pollutants in the air. It kills bacteria. And so if you think about it from a health perspective, we're in a COVID-19 pandemic still to this day. And so smudging offices and smudging areas of our clinic is also very important, not only to provide a really spiritually blessed, safe zone, but also to purify the air in which we come across. I talked a little bit about, I referenced drumming, music and dancing, jingle dancing. Music is extremely important. We have the Eagle Heart Drummers as part of our organization. They show up at every event that we lead, every event that we host, and every event that we collaborate with. We offer our Eagle Heart Drummers. Now, we support that program as an extension of what we do here at BIHP. So funding is allocated for materials and resources. Yes, our drummers are volunteers and they love to do what they do. They teach the songs. They were taught the songs by Jean Albitri, one of our elders. And the group now, mostly made up of older adults, teach our younger adults, and our younger adults teach our youth. We have these really neat small drums. I'll just show you really quickly. We made these as part of introducing drumming and in our talking circles, our youth groups for behavioral health, and in special events where we do GONA. This last GONA in October, we had a GONA here in Bakersfield, and we made these drums with the youth and taught them how to make these drums out of all raw materials taken from the earth. One thing that's important for all of us to know is that when you take from the earth, you give back, and that's why tobacco is so important. Identity, all of this ties back to mental health and feeling well and feeling part of a connectedness, not only to nature, but also to Mother Earth and to community. And so the goals, I guess, or the aim of producing mental health outcomes is really via these cultural practices and traditional practices. And symbols, talking circles, and storytelling is an essence of identity, right? We all have a story to tell. We all are either on a search for our stories, but that's what makes us resilient. And that's why our elders have been a big part of that framework of really offering our community, the resiliency. So symbols, if you look at our logo, there's 7 feathers, and the 7 feathers stand for the 7 generations of the 7 generations of Native Americans that BIHP has committed to for us to reach, a great outcome of mental health, because mental health is something that we do see a huge struggle in our communities. We talked to Dr. Hanson referred to like sexual abuse and some of these traumas. There's so much poverty, so much domestic violence, so much sexual abuse that has been endured in our Native American people, and yet they still continue to be very resilient. Resiliency has existed since the first day the sun came up, that the natives were here. And so they've been resilient then, and they are resilient now. So I'll turn it over to you at this point.
No, that's incredible. I'm so happy you highlighted, ways to promote mental health that are not just therapy. Obviously, that is a portion of how we can promote mental health and increase wellness in the community. But music, culture, traditional ways or mental health care practices, all those can be incorporated, like you said, with the Western style of treatment. That was something that I was interested to learn about today is, what are those traditional methods, and, how are, what we would consider diagnoses today, how were those things, those diagnoses perceived, traditionally in Native communities, and is it something that that has somebody alienated, or, you know, maybe one or both of you can speak to kind of the perception around mental health and illness possibly within the communities. And then I know we have a very diverse Native community. You know, not every tribe is the same, not every band is the same. So, you know, just the perception of folks who may be experiencing mental health or mental illness in their lives.
Well, you know, I think a fair amount of this is, you know, relatively recent, within the past couple hundred years or so. And, you know, I once sat through the Cherokee Nation history course that's put on by the Cherokee Nation of Oklahoma government, actually their tribal government. And I got a nice little certificate. It's hanging on my wall at the office. But one thing that I heard in that course was that traditionally, you didn't really have a lot of the trauma that you have now. And part of the reason for that is because societies were much more egalitarian. You know, there were distinct gender roles, but it wasn't the case that one gender was more important than another. And so women had specific roles. They farmed, they owned the property. And this was especially true in the Southeast, where you had much more matrilineal, even matriarchal type societies. But a man was not allowed to abuse his wife or his children. That was just not tolerated in the culture. And if something like that were to happen, then the woman's male relatives would handle it, you know, in a traditional way. There would be, you know, physical consequences. And if it was severe enough, it could include execution or even banishment. What people don't understand about, you know, Native societies is, you know, in today's society, the death penalty is considered the most severe, the most extreme punishment the state can impose on you. That wasn't the case in Native society. You know, the death penalty was one option, and it was a severe option, but it wasn't the worst one. Being banished, being separated from your people, from your family, that was the worst form of punishment. So maybe, you know, the equivalent of solitary confinement, although people were not confined, there were no prisons. But you might think of that sort of thing as being a more severe penalty than death. So, you know, if a woman didn't like the way she was being treated by her husband, then she would just collect all of his personal belongings and set them outside the front door, and they were divorced. And that was it. You know, so the fact that you have more equality here in society, I think is one thing that promotes a lot of respect, you know, traditionally, so that people are not abused, and so that you don't have the consequences and the effects of trauma that are generational. That's something, I think the intergenerational trauma is something that's happened because of colonization. The other thing is, what was the other thing? Sorry, I get too many things going through my head.
No worries, no worries. We can come back to you, because we do have a question that came through the chat.
Oh, okay, sure.
And I'll pose it to both Angel and you, Dr. Hanson, in regards to smudging. As it is a sacred ritual, what are your thoughts on smudging being commodified to the point that smudge sticks are now available in retail outlets as decorative pieces?
I completely disapprove of it. I mean, I don't know how you could stop it. But to sell medicine is a completely non-traditional kind of thing. Medicine should be given. Oh, and that was the other thing I was going to say. Traditionally, you know, if someone had an illness, they would call a healer or a spiritual leader. And, you know, that's how treatment would be given. And it was, you know, very culturally specific in terms of, you know, how those people conducted their ceremony and how they conducted their healing practices. But yeah, to commodify that isn't good at all. I grow sage in my yard. Actually, I grow the white sage from Southern California, and I grow the mugwort, which is more, local river sage, sometimes they call it, and it was typically used by the tribal folks in this area. I'd never sell it to anybody. If anybody wants some, I'm happy to give it away. But you should never sell medicine like that. It's, you're one step away from being big pharma at that point, and that's completely not traditional. I'll let Angel weigh on it on this too.
Yeah, I'm on the same side in terms of agreeing with you, not to commercialize it. One of the ways we get around that is that we work with our local Native Americans, very much like how Dr. Hanson grows it and gifts it. That's really the key. The key is that we also gift it ourselves. We're in the process of buying a new building, and at the new location, a lot of our urban Indian health centers, they have community gardens, and those community gardens are kept by the local people. And it's the local people who are at times most of the medicinal folks or the traditional folks. We tend to refer to them as the two-spirited people. Those individuals are our local healers, and these healers are the ones that sort of lead and run these types of programs. And so our plan in the new facility, because we lease this facility here, and again, I think when you think of barriers, right? Barriers that we're faced, it was so difficult to get the landlord who owns this building, who is non-native, to allow for us to grow this using dirt. Right outside my window, I see a bunch of plain dirt that's not being used, and they sort of, the upkeep and the garden and da. So all these excuses of why we couldn't do it here, which is what led with a mission to just buy our own building, which we will accomplish here in the next few weeks. We're very happy about that, because now our people have a home they can call forever. And so these are one of the ways that we can non-commercialize it, but rather offer it as part of just the uniqueness of our health center, for healing purposes and for medicinal purposes. And so, to answer that question, I think that we can't prevent it, because you're going to have people who are going to commercialize it and put all the right language on it and call it what it's not. But at the local level, we know, well, that won't work here in Bakersfield, because we do have a very large community of folks that rely on us. When you talk about trust and whether or not the Native American community is open, they're not very open to agencies outside of agencies like ours. And so they rely on us to really be the trusted organization that whatever it is we roll it out based on that community need, right? So that it's community defined. And I think that the diversity of our Native Americans that live here in Kern County have trusted us to do that well. And so, as long as we can do that well, we're not concerned of the outside influences, because those are going to have a harder time penetrating into the communities we serve. And we serve over 220 Native Americans that identify, with different Indian tribes across the nation. So we're dealing with a very large, diverse group of individuals.
Yeah, I'm glad you mentioned that, Angel, because one of the topics I wanted to touch on was how the importance of the trusted messenger in the community, right? So we've heard a lot about some of the policies and just historical things that have, traumatized essentially Native communities, and having that trusted messenger to deliver, healthcare information or what have you, like that is a cornerstone, or is paramount to the community. Like, is there anything is there anyone in particular, like how does that trusted messenger get appointed? Like, You want to talk to that a little bit?
There's a lot that we do for that. Our trusted messengers, are our board of directors. All of our board of directors are made up of, well, our bylaws state that 50% of our board of directors must be Native American. However, we're very blessed and fortunate to have 100% of our board of directors identify as Native Americans. They represent the home. We have Comanche, Bishop, Paiute, Chumash, Selenian, and Shalom. These individuals are from those tribes, and they are the trusted messengers. They are the ones that represent our people. For our organization, it's a non-electoral type seat, meaning we have a recruiting process and a onboarding process, but the board reviews applicants, and it's a very open process. Each year in December, elections are made or appointments are made, and that approval process is done at that level. And of course, I work very closely with the board. And then we have also community forums. Once a quarter, we have community forums where we pay for venue, we pay for food, and we do mailers, and we let all of the patients we serve. I just looked at last year's report, and we were distinguishing all the new tribes that were represented. So, when I mentioned 220, well, there's more now. Just with COVID-19, it really spiked up the need for resources and services. And so we had an influx of patients coming through our doors to seek out those services. And so we always invite that community. We keep them well informed, but we also invite them to have dialogue with our board of directors and I in terms of what the messages should be, right? What is it that we're lacking, or where is it that we can become stronger? What needs more attention? And so I think that really just helps us design and plan and implement carefully thought out messages for our community.
Yeah, when you talk about the community-defined care, community-defined needs, it's great that those existing supports are there to have those community forums and to kind of inform the services that you all provide. In kind of switching reels, but along those same lines, when we talk about doing a lot internally, for the Native community. Dr. Hanson, you mentioned that you have taught and studied about self-determination and governance. So I've did a little research on self-determination, but that is kind of the opposite of what, if I'm not mistaken, what Angel was talking about, to where it's the external help, right, from the federal government, and how that plays out. Is there anything that you can speak to regarding healthcare and access to services when it comes to self-determination with Native communities?
I think, the tribes typically have to rely on, because healthcare is so expensive in the United States,
Mm-hmm.
people have to kind of rely on the Indian Health Service if they don't have their own private employer-based health insurance, which some do, or nonprofit organizations. Fresno does have the Fresno American Indian Health Project, which is an organization that's very similar to the one that Angel runs. We also have up here the Intertribal Consortium, which is a coalition of a number of tribes, and they fund what's called Turtle Lodge, which is a recovery center. Basically, it's to help people fight addiction. It's a rehab. West Care is also an organization that serves Native people. They also serve non-Native people. And as far as some of the leadership of these organizations and, folks that people might turn to, we have local people that are in charge of all that. So there are people from the Chukchansi tribe. There are people who are Dumna Yokuts and Mono. There are Chumni, Mountain Maidu. Those are just some of the friends I can think of who have done this work in trying to help people out. And in addition to I think just sort of basic, treatment that people might need, there's always a cultural component to it. I think as Angel has already alluded to as well. But we do have some gardens up here, that people are sent to work in as part of their therapy. For one thing, it gets you out of a building, it gets you outside a little bit, but it gets you more connected with Mother Earth. And, so you get to connect with traditional methods of planting and harvesting, and you get to sort of relearn some of what's been forgotten. The elders get to pass on this traditional ecological knowledge to younger people who really need that as part of their therapy. So all the way around, it's good medicine. I would say a native perspective of healing is much more holistic than Western style medicine. If you don't feel good, you go to the doctor and they say, take 2 aspirin and call me in the morning or whatever. And native medicine is totally not like that at all. It's as much or more so about your spirit than it is just about your physical well-being. And of course, if you suffer from addiction or you've had trauma and you've tried to self-medicate that, you have both a spiritual and a physical problem that needs to be addressed and where healing needs to take place. So as far as self-determination goes, it almost comes down to say, the individual or the family or the community more so than, say, the tribe. There's not a lot of tribes who will have their own hospital, for instance, although I'm sure there's like hospitals on the Navajo Nation and, the physically larger tribes might have kinds of facilities. But in California, like Angel was saying, there's, 200 and some odd tribes here. And, not all of them are from California. And that's, a lot of us have been relocated here over the decades. And so we have a very strong intertribal culture where we can kind of learn from each other, but sometimes there's also misunderstanding. And I've stepped in it a few times myself, not necessarily knowing, some of the local protocols and that kind of thing. So a lot of tribes here not having a land base or not having a very large land base makes it difficult to have a lot of this self-determination because our cultures and our cosmology is very much tied to the land and tied to the water. And so when people are separated from their sacred places, it makes it much more difficult to do this.
Very true. I just wanted to add a couple of points to what Dr. Hanson is talking about, if you permit me to. The working in Tule River, which is a Indian reservation federally recognized, and working in the urban Indian health, there's a distinguishing factors between the two. And that all goes back to what Dr. Hanson mentioned about the Indian Self-Determination and Education Assistance Act, which was passed in 1975. Under Public Law 93-638, it governs how the funding that tribes use versus the funding we use. And we get the funding from Indian Health Services, but we get it under Title V, and Title I and Title V are distinguished what the funding is used in terms of self-governance. And so that's why you have urban Indian health programs, kind of like Fresno Urban Indian Health. There's 10 total in the state of California, because these are non-tribal health centers addressing self-governance for under ISDS. So there are complexities in that, but the major cry that we all have here in the state of California is that we do lack the hospital. If you look, Arizona, for example, is the nearest Indian hospital that's funded federally. And California, if you look at the population in California, it's significant enough to have a hospital, but yet through limitations, barriers, bureaucracies, and what have you, that's where the act doesn't really meet the need, if you will, for the whole. So I just wanted to add those 2 points, because sometimes folks have a difficult time distinguishing urban Indian health centers from tribal Indian health centers and the funding thereof, or the lack thereof, because one isn't a federally recognized tribe. For example, in Kern County, we only have one federally recognized tribe of the other Native Americans that are indigenous or native to Kern County. So Tejon being that Indian tribe that's federally recognized, who has the ability to compact, which is another fancy word of using for contract, with IHS to receive those funds to address self-governance and self-determination for their people only, for the membership, not and as well for everyone else, because they can't necessarily they cannot, if they receive IHS funds, they cannot turn away other rural Indians that live in Kern County. So Tejon being the only federally recognized tribe, we collaborate with each other because they don't have a robust health center at this point. And so they rely on us as well to provide or at least extend the services that we provide to everyone else. Like COVID vaccines, for example, is one of those things that we were able to provide here at the clinic, to offer those to our Native American people and non-Native American people.
Yeah, offer some statistics too to sort of back up what Angel is saying, just because people probably don't know this. California has the largest population of Native Americans in the country, and we're the largest state as it is. That's probably not too much of a surprise. Part of the reason why we have the largest population of Native Americans is because of forced relocations. But also we have 110 or so federally recognized tribes in the state, and then probably half as many again, so 50, 55, maybe more, non-federally recognized tribes that are still, native California tribes. And the state has the beginnings of a de facto state recognition process, which they've never had before. But James Ramos, who is a state assemblyman, was the first head of the California Native American Heritage Commission, which has sort of taken this on within the constraints of the state law. But in the state assembly, he's kind of pushing for more and more of that. And if there is such a thing as state recognition at some point, there might be more state funds that are available for those tribes, in addition to whatever federal funds might be available. And, sometimes there are federal grants for different things. And not only are recognized tribes eligible for this, but sometimes non-recognized tribes and tribal serving organizations are eligible for these kinds of funds as well. But they tend to be very specific, kind of categorical type grants.
Thank you for that. I know there's probably among non-Native folks and folks who are not regularly serving Native folks, there's probably lots of misconceptions about tribes and federally recognized and not federally recognized. So thank you for providing a little bit of clarity on that. We're getting close to the 1 o'clock hour, and I want to be, of course, respectful of the folks' time. But one question I want to ask, definitely before we get out of here, is what can mental health providers such as like DBH or our partner agencies do to like better connect with Native communities? Is it something where, we just work directly with Fresno American Indian Health Project, or how can we educate ourselves and make sure that we're offering culturally appropriate services and just reaching the community as best we can?
Well, I guess I would suggest, try to partner with Native serving organizations and follow their lead, because they know the culture. and you're less likely to make mistakes that way. And sometimes, even with the best of intentions, sometimes people can cause more harm. And, of course, in health, you don't want to do that. I think it's like the main rule, right? Do no harm. So I would say that would be a good place to start. The other thing is just be more culturally aware and listen. So when people say change the names or do away with the mascots because it causes us harm, be at least open to listening to the arguments that people are trying to make. So be a good ally.
And I'm glad you said that, because as a sports fan, I got my my eye on what's going on with Cleveland's baseball team, Washington's football team, even Atlanta's baseball team. Congrats to the Braves. But there's definitely some symbolism and lots of actions that take place that are derogatory and would have an effect and do have an effect on the mental health of our Native community. So.
Well, and you bring up a good point, because you have to ask yourself who put those symbols on there. It wasn't our people, and the other thing you have to ask is that, when folks are approaching us, be open, just like Dr. Hanson said. If we're asking you to take something off, or we're asking you to give something back, there's like county museums that have artifacts that don't belong to them, that belong to the people. And, and they make it so difficult to, it's as easy as, why do we have to go to the Board of Supervisors and ask them to give back what they took from us, because some settler way back when, inherited all of these items as part of a barn that existed on their property now. You have to really ask the deep question, what healing. That's a healing. When I talk to assemblymen or senators, I said, if you really want to help our people, this is how you can help them. Why don't you, county, donate a sliver of the river that you can't manage because you guys have underfunding, and we will manage that, 2 or 3 acres near the river to possibly put a sweat, because sweat in our people is a form of healing. It's a form of giving them back something that they identify with and they connect very much with. And then also, just policies and procedures. The county, you have to understand that gift giving is a huge part of what we do. It ties back to generosity with GONAs, and gift giving promotes connectedness. Consider revising policies that create barriers to this cultural practice, because county systems or government systems have these sort of catch-all policies where, you want to be very careful. Think about somebody who walks in through your doors to seek out mental health, and their first form of really establishing a form of trust is to give something away, right? Because here's somebody offering themselves up as a way of creating that space of safety and belonging, and building rapport, because that's important. Well, the policies prevent that, and so right off the bat, by saying, hey, no, I can't take that,
alienating,
right? You really at that point have killed all your opportunities to really offer some form of wellness for that individual. And so here, we have very policies conducive to that practice. Now, of course, you got to be careful. You can't just accept gifts all the time, but or individual gifts that benefit the individual. And so we're very educationally prepared to offer that education to individuals. Say, look, thank you for this gift. We're going to put it in a certain location where everybody can enjoy it. And so we have a safe space for doing that. But again, I think those are just solid points in terms of what you were asking.
Yeah, thank you. There was a question that came through on the chat. Are there identified gaps in service that we can address in the short term? And I think this is from the perspective of service providers.
Well, Dr. Hanson, feel free to jump in. I'll just tell you very briefly. The way I think that individuals, individual organizations can really foster collaborative effort is just reach your local agencies that are doing the work around promoting, Native American wellness. And we have three major ones here in Bakersfield. We're one of them. Owens Valley Career Development Center is another. And the local tribes or the local Native American organizations, whether it be veterans-led, whether it be culturally based, you'll know if those agencies identify with a respected and agency that we vouch for. But here we have three that we collaborate together, we work together. So start there.
Thank you. And Dr. Hanson.
I would echo that too. Just wherever you're at, start with the respected agencies and work through them and try to do it respectfully.
And how can we support the Native community here in Fresno? Are there current initiatives or places that we can go to learn or to provide support for the community locally here in Fresno?
If there are any lectures, you might want to attend those. And like I said, though, be a good ally. There are local Native causes. The city recently, which is how I think you found me, the city recently had a proclamation recognizing Indigenous Peoples Day. And they did it at the city council meeting on September the 30th, which was also Orange Shirt Day, which has become an observance on the boarding schools and sort of a reflection on historical trauma and those kinds of things. So wherever you see kind of outreach like that, those might be avenues where you can make contact with people and, get to network with folks a little bit. And, just remember that we're still here and there's more of us than you think. So
I love that hashtag. Still here.
Dennis, also, I think a lot of agencies have the capacity to donate, and we're a 501c3 nonprofit organization. Most of the Native organizations are nonprofit; they're not for profit. At least those that are providing, medical or behavioral health services. So, donating to our agencies allows us to really provide unique services that we can't otherwise provide from the restricted funds. We can't buy food. We can't, I'm talking about generally with the funds that we receive from the federal government.
Right.
They're limited to not being able to purchase food or house homelessness, or, specialized treatment for opioid addictions and things like that, right? We have to go after these big, large grants that are difficult to obtain. And so donating to organizations such as ours allows us to use those funds to bring wellness to the hurting, to the people with the most pain, to the folks that really need those services. Their essential services are those kinds of things, and those kinds of things impact the wellness, the mental wellness, and the spiritual wellness of our people. So I always say that if your organization can donate, you can start there as well.
Awesome.
Yeah, the non-recognized tribes are typically organized as 501c3s or another nonprofit status under the tax code, and many of them are happy to accept donations too. And in the valley here, we've got about 24 California Indian tribes, maybe more if you go farther south down where Angel is. But only about a third of them are federally recognized. The rest of them are not recognized and often struggle for funds because of that lack of recognition, which is intentional. It's government policy.
Thank you for that. Definitely want to lift up those organizations and those agencies and encourage those of you that are listening to get involved, to donate, to just really make those connections with those groups that are doing the work. The department, of course, will be sharing more resources throughout the month, different books, other resources, videos that we will share on the Native community. At this time, I think there are no other questions that are coming through. I wanted to give both of our guests an opportunity to highlight or promote something that may be coming up for the Native community. I'll start with you, Dr. Hanson.
Okay. Yeah, Fresno State is having a Native student recruitment conference, and it's been organized by our Native outreach coordinator, Amber Esquivel, who is Chukchansi. And it's primarily geared at students between 6th grade and 12th grade who are maybe thinking about going to college. So college can be a big, scary thing. You know, it may require you to leave home and leave your community. And so it's often an intimidating thing for Native people. So the more times we can kind of get people on campus, the less scary it will be. But if you're Native and you have kids, or if you know anybody who is or does who might be interested, I'm happy to have that information shared.
And I believe we have the flyer up on our live streams now too. And if you need more information, Dr. Hanson, did you want to share your email address? Or?
Yeah, you can email me. My email is Kenneth H. So it's my name with an extra H on the end, at mail.fresnostate.edu. So Kenneth H. at mail.fresnostate.edu. And I can put you in touch with Amber or just forward that flyer on. The date is November 19th, and I think it goes from like 9:30 in the morning to about 2 in the afternoon. It's something we do every year.
Awesome. Thank you for that.
Thanks for the opportunity.
Of course. Angel.
Yes, thank you. Really quick, we are having our first annual Native American Heritage Month luncheon. Our theme is Rock Your Mocks. It's a commemorative of what it means being Native American in Kern County. Our learning objectives for the conference is around healing holistic practices in Native American Alaska Native communities. You know, we'll be talking about care coordination opportunities to advance health equity and mitigate toxic stress due to COVID-19 for Native American youth, children, and their families. Other learning objectives will touch on traditional medicine, drumming, dancing, artifacts, archaeology, and we'll just dialogue with vendors and exhibitors. And so we're going to have a lot of our local Kern County collaborative partnerships exhibiting there at the conference. The conference is this Saturday from 8 a.m. to 4 p.m. The agenda, the registration's from 8 to 9, but you know, folks are welcome to come in right at opening, which will be 9 o'clock, opening in prayer. We'll be honoring our veterans as well via acknowledging our veterans and then just doing ceremonial song for our veterans. So I think you guys have the flyer again. It's Saturday, November 6th. This Saturday, it's at the Marriott at the Convention Center here in Bakersfield. It's 801 Truxton Avenue. I look forward to having you there. We're going to have some amazing speakers. And we'll have a really nice lunch for everyone, some light continental breakfast in the morning, coffee and whatnot. So we look forward to having our community there, our allies, our partners, as well as all of our Native American, Alaskan Natives peoples at this conference. Thank you.
Awesome, Angel, and rock your mocks. So
rock your mocks. Yes, sir.
Please come in your mocks and your Native attire. All right. Well, this has been an awesome conversation. I really appreciate both of you being available and participating. I'm honored to share this space with you all. And we can wrap it up here. And I'm so glad that you have the opportunity to share how folks can reach you or interface with your agency and Angel's agency with the Rock Your Mocks event that's going on. I thank you so much. I look forward to doing this again. You know, I hope that we can have you back in some capacity, if not here on Zoom in person one day. We'll get back to the in-person events. So I thank you both for your time, and Ahmad passes on his thanks as well.
Mm-hmm. Thank you.
Thank you. Thank you for having us.
I learned a lot from this.
Yeah.
So did
Yeah,
I.
that's very informative on all sides. Thank you so much. And we'll end it here. Thank you all for watching, whether on Facebook or YouTube. We will have this recorded. So if you did miss the beginning portion, you can go back after the live stream is completed and watch that at your leisure. So thank you so much. And we will talk to you all next time. Take care, all.
Thank you. I hope.
Oh.